I went to the doctor and found out that I had a biopsy done. And I had alopecia, fatigue, because I had scarring alopecia in the part where the baldness is and smoothness is. They were like, you'll never have any more hair there. Just a little bit that you can learn. It's a lifetime worth of information that will change your life.
Hey everybody, today we're going to be talking about all about hormones and autoimmunity, but I want to introduce a series that we're starting, and it's called Real Autoimmune and Real Hormone Transformations. So you guys have heard from multiple trainings I've already done that I've created a beautiful guide. In fact, a whole workbook on what are the checklists for hormone symptoms, and also what are some of the natural ways to start turning around your hormones naturally. If you want the guide, what you want to do is go ahead and check above or below this video, and there's a link to chat our team. Just ask for our hormone balancing guide. That'll be great, right? Go ahead and do that. If you want help in turning around your autoimmune or hormone issues, please go into the comment section below and give us some detail about what hormonal struggles you have and what autoimmune struggles you have, and our team will respond to you in a couple of hours. Check your message requests, and we'll be responding with some resources to get you started to get help. Today, what I want to do is introduce a series we're doing, and it's all about real autoimmune change and real hormonal balance. How are they related? We've already done trainings on what are the symptoms. And we've done trainings on what are some supplements that can be helpful, herbs that are helpful in balancing hormones. But people want to know, well, how does balancing my hormones actually impact on my autoimmune disease? And does it impact on this autoimmune disease, that autoimmune disease, or no symptoms of autoimmune or no diagnosis of autoimmune? Can it help me? I want to answer that question by presenting this series, which is a series of real people, real autoimmune issues, real hormonal health, and real balancing of those hormones with what their real results really are. So truly, true hormone and autoimmune transformations. We're going to be premiering different videos with different real people and their autoimmune issues. And we're going to show how their story is and what their experience has been and what their outcomes are, to actually show you that, yes, this stuff really works. Hormones and autoimmune's really linked, and it can work for any diagnosis or no diagnosis whatsoever. So welcome to our series on real transformations and real hormone balance in autoimmunity. So here we go. And I hope you enjoy this video today. Hey, everybody. So here's Shyrell and Martin. Shyrell, tell me a little bit about yourself and what were some of the biggest obstacles that you've been dealing with before you joined the program.
So before I started the program, some of the things that I was going through, I went to the doctor and found out that I had a biopsy done. And I had alopecia, fatigue, lots of fatigue, pain in my ankle and swelling, and enlarged thyroid. Those were some of the things that I was dealing with at the time.
So official diagnosis, did you have any official diagnosis that was autoimmune, Shyrell? Because I think this really highlights, a lot of people don't realize that, you know, even without a diagnosis or even with a diagnosis, you can have a myriad of other targets and symptoms. So what was your official diagnosis or diagnoses that were autoimmune?
Just hypothyroidism and alopecia. Those were the only two that I was diagnosed with.
Okay, so you had two diagnoses and two targets of autoimmune attack that you knew of, but you were still experiencing extreme fatigue and pain.
Yes.
Well, where the hell was the pain coming from? You know, a lot of people don't realize these are autoimmune targets. Why would someone with thyroid problems or alopecia, hair problems, have joint problems? I want to ask a question from 0 to 10, 10 being the worst pain you've ever experienced in your life and 0 was no pain. What number was your pain before the program?
A 10.
And how long was the pain a level 10?
It was like that for at least, before I went to the doctor, it was before that, I would say at least 5 to 6 months in pain. Yes.
So I'm going to ask you or Martin can you describe to people a moment when you had 10 out of 10 pain where you knew you hit rock bottom?
I was coming up the stairs one day, and as soon as I got up to almost the top, it was excruciating pain in my left foot. So much so that I almost fell. And then about to fall, the pain was just shooting, throbbing pain. So much so that I had to make an appointment to go see the doctor. And when I did go to the doctor, of course, I had to get a boot because I couldn't walk without it. The pain was so severe. And of course, pain meds to try to ward off the pain.
So suffice it to say, like, you were seeing specialists for your thyroid, you were seeing a specialist dermatologist for your hair, now you're seeing a podiatrist for your foot. All these specialists that you saw, it sounds to me like more and more prescriptions. And
that's right.
Yeah.
And what were the results after like months or years of seeing these other specialists? What kind of results did you have with that kind of treatment, which is typical, by the way?
That's all, more and more pills, just because the pain, they will relieve it a little bit, but it's temporary. After I went back to see the podiatrist for a follow-up, she decided, and I didn't even know this, she was thinking about putting me through surgery. And I didn't even know it was that bad that I would need surgery.
Sure. I mean, 10 out of 10 pain is pretty bad, first of all. But second of all, something to realize is when you go see a podiatrist, when you go see a surgeon, their job is really to determine whether meds are going to work or not, and they don't, and it's really surgery. That's the only two offers that they have. When that's the only two offers, they really are not thinking about anything else, which is what we do in the program, which is what is causing this problem, which we have identified in you as an underlying autoimmune issue attacking many different targets. Mm-hmm. So, question mark. You are just graduating from our 2-month online program.
Yes.
And which works directly with me and my team. And my question is, what are your results now?
I'm pain-free in my ankle. There's no swelling. Also, I went to get my hair done, and my stylist said, "What is going on with your hair?" And I was like, "Oh, no, don't let some more hair be coming out." I was like, "What you mean? What's going on with my hair?" And she said, "I see hair follicles. What have you done?" I was like, "What?" It made me so happy. Oh, it really did. To know that I've only been in your program for just 8 weeks. And it brought me, I couldn't believe it. Also, my thyroid. I had Martin, because he normally checks my neck. I have him always check
Oh, Martin, I bet you were checking out her neck.
Stop it.
So the best thyroid examiner on the planet, what did he find?
On her right side, it's almost totally, when you palpate it, you can't even feel the thyroid.
No.
But previously, there was some inflammation there.
Yeah.
And in the left side, there's been a tremendous reduction in inflammation.
Yeah.
Well, wait a minute. What you two just said defies conventional medicine and 99% of the experience of people with autoimmunity on the planet, which is they go to their dermatologist for alopecia, get a diagnosis that it's autoimmune, and it's like, that's just the way it is.
Right.
Go to the thyroid doctor, the endocrinologist, and say you have autoimmune thyroid and you've got some Goomba going on in your thyroid, and they say, that's just the way it is. It ain't going to change. What you just described are miracles.
It's totally a miracle. That's how I feel. I mean, from my stylist telling me that, and because I have scarring alopecia in the part where the baldness is and smoothness is, they were like, you'll never have any more hair there, you know. And so when she parted my hair in this fineness, she's like, what have you been doing? You know, I was like, what? And she was like, in your hair, there's follicles. And I mean, that really got through me. It really did.
Well, so your stylist and other people are asking, I'm sure your dermatologist is going to be asking you, people want the lowdown. Can you give me 1 or 2 things that you have learned about yourself in this process? What are you doing differently? It's just 2 things out of, I'm sure, hundreds that you think has caused these results to happen. The gone pain, the thyroid swelling all down, and the hair growing back. What are 2 top things that you think you learned?
2 top things I've learned is how to control my blood sugar. And also, I've gone gluten-free. And that has meant the world to everything. And also, you know, I'm hormone balancing. So my diet is just eating the vegetables, and, you know, it's more cooking. And he's my cook too. So it's just been more cooking, but it's healthier. I just feel better about myself, and I have more energy, you know, the fatigue and everything. It's just all falling into place.
Hey, Martin, if you're the cook in the family, these 2 months of working with us and our team must have been a huge education for you on actually how to cook to heal her.
Yes, it was a challenge. The prep work is time consuming. Instead of just, you know, throwing something in the oven or throwing something on the stove, the preparation is what's time consuming, but the results are well worth it. Her skin is softer too.
You go check that out every time you can.
I'm serious.
You're like,
not just on the neck.
You're like, oh, baby, you're speaking so smooth. Can I touch it over and over again?
Yes.
All right, Mr. Martin, I have a question for you.
Sure.
What does it feel like getting your wife and your girlfriend back? Do you have a story of something? Well, first of all, what does it feel like to get your wife and your girlfriend back?
It's pretty impressive. It's a blessing. I mean, we've been together 25 years. And we're still in love. It's just, I got everything I need right here.
I'm going to ask both of you this story. What's something that you two have been able to do together in the past a couple weeks that maybe even 2 months ago was unimaginable?
Yeah, walking. We can go out walking together for a few miles without paying free.
Yeah.
Both of us.
Yeah.
Previously, she had with the ankle problem. She couldn't walk the way she walks now. So
yes,
we can spend more time together exercising.
Yes. That I couldn't do. 2 months ago, I couldn't have done that.
That means vacations are possible now.
Yes. I am so happy about that. And so we can spend more time together doing that. To walk without pain is amazing.
Shyrell, I'm going to ask you this question, which is, if there's somebody right now, just like you, before you got to know me, I'm sure you were at one point sitting in front of a computer looking to see whether you should watch one of my videos. And if you could talk back to your old self and you were sitting in front, if you're talking to someone right now, me, I'm somebody who don't know Dr. Maggie of the program, and I'm about to decide whether I'm going to watch this training or not, what would you say to them?
I would tell them, don't hesitate. To watch one is just to see what could change your life. If you like saying, well, maybe I need to watch it, maybe I shouldn't, it will change your life. I mean, you shouldn't even hesitate to watch it. I mean, you get so much from it. I mean, and it's just not just a little bit that you can learn. It's a lifetime worth of information that will change your life.
I'm going to ask Martin and you, what's one of the biggest things you learned about yourself that surprised you during this process?
Well, the best thing that I've learned, because I'm in healthcare, I learned that me being a patient, just like everybody else, that I could fall through the cracks too and not really know a lot about what's going on with my body, thinking that, because I do research. So that's my thing. I love to do research. And so learning this about myself has opened up so many more avenues for me, that me taking away what I've learned in the program is going to mean something to me for the rest of my life. So I'm not only taking the tools and I've graduated from your program and stop. It's going to advance me on to my future.
Shyrell, can you tell everybody what you do in healthcare?
Yes, I do clinical research for hematology oncology, which is cancer research. That's what I do.
So, Ms. Cancer Researcher, my question for you is, a lot of people think all they need is more information. They just need to research Google more to get the answer to how to solve this problem with their autoimmunity. I've always said to people, it's not more information that people need, because more information can be overwhelming, even to a cancer researcher.
Yes.
And that's
true.
What people lack is mentorship and coaching to teach them which pieces of the information applies to them and how they work together. Integration and mentorship is what's missing.
So true.
More information. What are your thoughts about that?
Yes, I would definitely agree with that. Coaching and mentoring from somebody who's been there and knows. I mean, you can read, but if you get somebody who's been through it and experienced it, themselves, you can't get no better than that.
You know what I think about it this way, Shyrell, is that me as a medical doctor being through what I've been through myself, being sick with mystery illnesses and autoimmune targets like crazy. And I think about the over $1 million that I've invested in my own education and trial and error to figure all this stuff out. Mm-hmm. To me, like, to be able to teach someone to do this in 2 months versus 20 years, that's the process for me, is to me a huge blessing of being able to, why not do it faster, better, more effectively from somebody who's gone through it already?
Yes, I would agree with that, because I've been going through some of the things like endometriosis, all kind of things all my life, headaches and all this. And then to get into a program in 8 weeks, to be pain-free and headache-free and everything just decreasing. And having hair coming back. And I mean, I can go on and on.
My thing is cut through the chase. If you can get these results, things that have been bugging you for decades, if you can turn this around within 2 months, that's quicker, faster, and more effective. That's worth it.
It is worth it.
It's
totally worth it.
Yes. All right, everybody. Thank you so much. That was it. You rocked it. That was amazing. Thank you so much for your time, you two.
No problem, Dr. Maggie. I mean, I thank you so much. You just have no idea of what you've done for me. It's just priceless. So I thank you for that.